Okay, good evening to you. I hope you're well. Today we'll be looking at the key health priorities here in Ireland. We'll be looking at the major chronic diseases, and in particular, we'll be looking at the underlying risk factors that are driving those chronic diseases as a basis for our health priorities here in Ireland. Firstly, let's have a look at Ireland at the moment. Our life expectancy has been increasing over the past few decades, and the greatest gain in life expectancy has been achieved in the older age categories, reflecting decreasing mortality rates from major diseases. Ireland's life expectancy is now above the EU average, and when we consider that Ireland has a high GDP, it would paint a fairly healthy picture of Ireland. However, we have an increasing disease burden. Ireland people are living longer lives, however, incidence of chronic disease is rising, and so too is our drug budget. The lower socioeconomic areas are the worst hit by chronic disease rates, especially the travelling community and deprived areas. If we look at two of the leading diseases, chronic diseases in Ireland, circulatory system diseases and cancers, their mortality rates have dropped in the past 2 decades. However, and importantly, the incidence of these diseases has not reduced. So the prevalence of chronic disease in the population continues to increase due to a reduction in mortality and also due to increasing incidence of chronic disease in the population. We know from the data and the research that these major chronic diseases in Ireland tend to affect people as they go through life into older adults. However, we also know that these chronic diseases tend to begin as early as childhood and develop through the lifespan. We can see that there is a slightly higher death rate for males and females in Ireland. And if we look at this data from the Global Burden of Disease in 2019, we can see the 5 leading chronic diseases in Ireland are ischemic heart disease, lung cancer, COPD, lower respiratory infections, and Alzheimer's disease. If we dig a little bit deeper in that same data, we can look at the risk factors that are driving those diseases. And we can see that tobacco, high blood pressure, high body mass index, dietary risks, and high fasting plasma glucose make up the top 5 risk factors for disease in Ireland. And it's important to look at the high body mass index, which has risen greatly since 2009, and also high fasting plasma glucose, which has raised even more by 65% since 2009. High blood pressure in Ireland, 60% of people aged 45 years and older had high blood pressure in 2018, and this number is rising. The majority of men and women with high blood pressure are not being treated, which of course is a concern. If we look at another one of those risk factors, overweight and obesity, we can see from this data from the World Health Organization that 1/4 of adults are obese, and a total of 61% of adults are overweight or obese. 66% of them male, 55% of them female. And we know from evidence across the globe that the prevalence of overweight and obesity is starkly increasing in children and adolescents over the last few decades. There is a lack of specific data on type 2 diabetes here in Ireland. However, we do know it's a disease that is on the rise. We do know that there is over 200,000 people living with type 2 diabetes in Ireland, and it is estimated that over 100,000 people are living with type 2 diabetes untreated. It is definitely a disease on the rise here in Ireland. We know that much. So if we look at the 5 key main risk factors for disease, they will form the basis of our 5 key health priorities in Ireland. As we know, to reduce the prevalence of disease, we must target those 5 known risk factors for disease. If we look a little bit closer at those, we can see that all of those risk factors are related to diet and lifestyle choices. And in fact, 4 of the top 5 risk factors for chronic disease are directly related to diet. And we know that chronic disease rates can best be lowered by targeting improving diet and lifestyle at a population level. So if we take fiber consumption, we know from the science that fiber can improve high blood pressure, high BMI, and high fasting blood glucose. We'll return to that in a moment. Fiber consumption in Ireland first. How are we doing? So Ireland's recommendation is for at least 24 to 35 grams of fiber a day. However, 78% of Irish people are not hitting 18 grams a day, and 37% aren't even getting a minimum of 12 grams per day, which is a worrying statistic on our dietary patterns here in Ireland. Many studies have found that people on diets high in fiber have reduced risks of certain diseases such as cancer, coronary heart disease, obesity, and possibly diabetes, which are the key and leading diseases here in Ireland. And this is done by reducing the underlying risk factors of these diseases. We know that increasing consumption of dietary fiber is a critical step in stemming the epidemic of obesity found in developed countries like Ireland. The Health Service Executive of Ireland recognises the importance of targeting diet and lifestyle choices in their national policy priority programme. And indeed, they state that changing lifestyle habits is our greatest challenge and the one that will have the greatest impact in targeting these diseases. So in conclusion, tackling the leading risk factors for disease can lower the burden of disease. By increasing fiber consumption at a population level, that can target 4 out of the 5 top risk factors for chronic diseases. And so that increasing fiber will be the focus of our priorities for reducing these risk factors. Who is our target population? Of course, it is the large majority who are failing to consume that recommended 24 grams of fiber per day. Thank you for your attention and time. I appreciate it.